This is my annual poison prevention episode in honor of National Poison Prevention Week, which is coming up March 15th through 21st, 2026. Welcome to the Pharmacist's Voice Podcast, episode 368. I'm your host, Ohio pharmacist Kim Newlove. The topic this year is the risks and benefits of using medications for opioid use disorder from a poison prevention educator's point of view. My guests are poison prevention educators Angel Bivens, RPh, from the Maryland Poison Center, and Dr. Wendy Stephan from the Florida Poison Center in Miami, Florida. Stay tuned until after the interview. I will review the top takeaway messages for pharmacists from this episode. So if you're a pharmacist, maybe a pharmacy student or a tech too, there's going to be some takeaway messages for you at the end of this episode. Stay tuned. The show notes for this episode will also have those takeaway messages, and you can find those show notes on thepharmacistvoice.com. In the show notes, you'll find, like I said, the takeaways, but also links to our other poison prevention-themed episodes. Like last year, we talked about poison prevention education in older adults, and the year before that, we discussed poison prevention cases and resources for young adults ages 18 through 24. We also have several other poison prevention episodes over the years, and we plan to come back in 2027 with a new topic. So if you like today's episode, please check out the others that are listed in the show notes and follow this podcast for our March 2027 poison prevention episode in 12 months. Without further ado, let's hear from returning guests Angel Bivens, RPh, and Dr. Wendy Stephan. Wendy and Angel, welcome back to the Pharmacist's Voice podcast.
Thank you.
Glad to be here.
It's good to have you back on the show. I think this is at least the fifth interview with both of you together. This is great. At this time, though, there may still be people who have not heard your voices yet. So, Angel, would you please introduce yourself first?
Hi, sure. My name is Angel Bivens. I'm the managing director at the Maryland Poison Center in Baltimore, and I'm a pharmacist by training. So made my way to the Poison Center from the land of pharmacy.
Thank you. And Wendy?
So I'm Wendy Stephan. I'm the educator and epidemiologist at the Poison Control Center in Miami. I'm also on the board of directors of America's Poison Centers, which is the organization that supports all 53 poison centers in the United States.
Thank you for the introductions. At this time, we're going to dive right in. And Wendy had brought an idea to our group during our planning discussion that there's some good news out there. And that is that there's a lot of people in recovery and they're doing well. I always like to talk about statistics because as pharmacists, we love stats. So, Wendy, can you talk to us a little bit about recovery?
Yeah, so, we've had some very positive news coming out in terms of reductions in overdose fatalities. And so that's the context sort of that I was thinking. And so when you think about our reduction in overdose deaths, some data just came out. And so we saw a 26.2% reduction in overdose deaths between 2023 and 2024. And so there was a lot of questions about wow, has there been a silver bullet? And I think it's a complex answer. But one of the benefits has been, getting people into treatment after the pandemic. A lot of people's treatment was disrupted or they had difficulty getting into treatment for their opioid use disorder. So that seems to have stabilized. We're getting more people in treatment and people are succeeding in treatment, right? So you mentioned we have 23.5 million people who describe themselves as being in recovery or recovered from a substance use disorder. And so these are our friends and neighbors. And I think that is something we're talking about more. And I think that's also a very encouraging part of the whole picture.
Thank you for sharing those stats. Angel, did you have anything to add to that?
I think that the main thing to add is that over time, with this positive news, I think also trying to move people toward recovery needs to be parallel with taking away the stigma of somebody who has a substance use disorder and understanding that it is now being viewed as something that is treatable. And part of being successful is to remove this stigma.
I love that you brought up the stigma piece. Thank you so much for saying that. I think the more that we talk about it, the less shame there is in talking about it. And I think that's important for pharmacists, students, techs, anybody to know that recovery is not just possible, it's probable. People are doing it and people have done it. Wendy, anything to add before we move on?
Yeah, so another piece of that puzzle in terms of what's moving things in the right direction is prevention. And so, poison centers do a lot of work in communities and in schools, elevating information about opioid risks, helping people understand, what is an opioid, where might it come from, where might it be hiding, in the codeine in your medicine cabinet, or those pills that came home from, your dentist after the wisdom teeth were taken out. These are the things we're trying to just put on people's radar. And then also what we would call tertiary prevention, which is, what happens when there is an overdose, when it has occurred. The use of naloxone more widely is key to this success. And so making sure people have naloxone or Narcan, or there are a bunch of brand names now, and know how to use it is also part of this really improving picture. It's still a serious problem, but we're definitely heading in the right direction.
That's so good to hear. Angel, anything else before I move on?
Yeah, Wendy mentioned the opioids in the wisdom teeth medicine. I want to go ahead and give a shout out to the great awareness campaign that happened several years ago, basically kind of calling to light that when student athletes or teenagers have injuries and need to have surgery or have their wisdom teeth out, they can likely be managed with over-the-counter pain medicines. And we don't need to give them the high potent multiple tablet prescriptions of opioid containing pain medicines. And I think that was part of the way that some teens were getting hooked. I also think that that's some of the ways that these medicines find their way into homes that young children get into, because your teen might not have used that prescription and you forget it's there, and somebody then comes along and finds it, whether it be a toddler or, something like that. So I do want to applaud the whole movement of use the medicine appropriately. There is definitely a need for the stronger opioid pain relievers, but it's not every type of pain that they're needed for.
You bring up some excellent points. That is an entry point for addiction. Some people start abusing opioids because they start off with something innocent, like an injury, like that wisdom teeth extraction, and they have the opioids for the first time ever, and their brain is young, and it says, hey, I like this. So yeah, you're right about that. And I know we're on kind of a different topic already. Wendy, did you want to add anything to this discussion?
Well, I wanted to just give an illustration of that point, sort of with availability. So one of the cases I reviewed for our discussion today was a case in which a 17-year-old girl, got access to a family member's buprenorphine and just snorted it, crushed it up, snorted it with her friends just to have fun. And that was the quotation in the notes. And so I think, again, that access and that curiosity at the teens, we know they're impulsive and that type of thing. So access can really lead directly to experimentation, which for a subset will turn into a problem over time.
For an opioid naive individual like that young person too, it makes quite the impression. And I can see how they would be drug seeking from that point forward. And they could end up losing the next 5 to 10 years of their life seeking drugs and going through that cycle of getting into recovery and then relapsing and so on and so forth. And that's where a lot of these medications that we're going to talk about in a little bit come into play. They have benefits. They help individuals who struggle with opioid addiction to recover. But then sometimes we see relapse and then recovery again. There are benefits, of course, but then there are some risks. And the risks is kind of what the focus of the conversation is going to be. Angel is a pharmacist, of course. I'm not going to ask you doses and frequencies and all the things. But at the pharmacy counter, Angel, you and I both know that we have the opportunity to counsel, not just counsel on how to take something, but also to counsel on things that will prevent overdoses. and further addiction problems. We've got the Narcan nasal spray. I think Wendy mentioned that earlier. There are several different brands. There's generics out there and whatnot. There is the Vivitrol shot, the naltrexone shot. We've got the Suboxone. There's all kinds of things out there. Suboxone sublingual. I believe there's the injection now. There's all kinds of drugs out there. But when they're not used properly, they can cause problems. Meaning, maybe somebody didn't store it, so then a child finds it. Angel, what things could go wrong when a medication that was prescribed for opioid use disorder gets in the wrong hands?
Tragic things can certainly happen. So we want to make sure that when we're dispensing things like Suboxone, first of all, you mentioned that there's sublingual tablets. So just think, if a child gets into that tablet, how quickly that's going to get absorbed. Gets absorbed very quickly by the person. Anything that is sublingual is fast absorption. That tablet is going to dissolve equally as quickly if a child gets into it. So we need to make sure that these medications are absolutely stored someplace safe. Poison center educators use the term up, away, and out of sight, and that is a must. If you have the ability to lock this one up, I think that that's the one that you would want to, because it really would only take one of those Suboxone tablets in a toddler to be potentially a tragic outcome. If a child gets into something like that, please, please, please call the poison center right away. No judgment, calling the poison center. It's going to be let's help this child. Let's get this child the help that they need right away, and we'll go from there.
Angel, not to interrupt, sorry, but how do you know when to call the poison center versus when to dial 911?
Excellent question. Basically, if somebody is not breathing, is unconscious, or is having seizures, got to go 911. Not a whole lot that somebody over the telephone can help you with there. Now, you can sometimes parallel, call 911 and then call the poison center so that we can go ahead and get involved with the case right away. But that is the cut and dry. If one of those three things is happening, you want 911. Other than that, you can call the poison center and call us right away. Don't wait for symptoms, okay? Don't just say, oh, I'll watch, maybe it'll be okay. We do our best work. Poison specialists do their best work. If you call us right away and we can give you preventive actions to take right away, we can make that judgment call. Do you need to call 911 if the person is still awake? Are they going to deteriorate rapidly that you need to get 911 on the way there? Do you need to make your way to safely transport yourself to the hospital? And we can also tell what to look for, okay? But in the case of a small one getting into Suboxone, that's going to be one of those situations where we're probably going to get you in right away.
Angel, real quick before I go to Wendy to ask her for her thoughts on this, I wanted to ask you, do poison prevention educators ever counsel on not taking medication in front of children so they can't see it go into the mouth? Or maybe if it's a tablet or the strip, some of those strips, they look like bubble gum or something like that, chewing gum. Mm-hmm. So anyways, your thoughts on that?
Yeah, absolutely. Little children learn by imitating adult behavior, right? And so they're always watching you, whether you realize it or not. Usually the first time this becomes apparent is whenever they mimic what you have said, okay? And it's the most inopportune time, when they repeat something that you have said out in public that you really don't want a small person saying, okay? We've all experienced that as parents. But they watch you take medicines and they think, oh, I want to be just like mom or dad or grandma or whoever. And so, yes, that is one of the ways to kind of prevent children from getting into things, is just don't take medicine in front of children. They're not going to see what you're taking. They're not going to see how you opened it. They're not going to see where you got it. So just try to not have the child around whenever you're taking medicine to eliminate that likelihood.
Great counseling point, and thank you so much for sharing that. Wendy, anything to add about this topic?
Sometimes when we talk to clinicians about opioids and the Poison Center, they think, and sort of I thought initially that maybe we're not getting a lot of calls from clinicians because they're so familiar with treating an opioid overdose with naloxone. But I took a look at our Florida data for the past 10 years, and we had over 28,000 calls about opioids in that time period. And then just from the 1st of January in 2025 through today, we've had 248 calls specifically about these therapies for treating opioid use disorder. So we do get these calls, right? And I was interested to see that about 60% of those calls were coming from hospitals. And so we are getting consults, and I think that's great. More common, it is actually only a minority of the calls that are about the tiny ones, thankfully. But yeah, or that it's an unusual presentation, or it's an oral formulation, or there's other, drugs on board. Do they have to consider, or there's pregnancy? So these complicated factors looks like when we're getting the calls, and we're happy to receive them.
I love the case data that you bring out because it makes it so real. You're really getting hundreds of phone calls about these medications that treat opioid use disorder. Thank you for sharing that. I like it when you bring up cases, so we'll make sure that we stick in more of those as we carry on. Back to Angel. What are some of the other risks or things that could go wrong with medications that treat opioid use disorder or the rescue medications?
Something that can go sideways is this is a journey, and you're using the medication to treat the substance use disorder. You have to really make sure that you're not going to relapse. Take something else along with that medication. Some of these medications are long acting, right? You mentioned the naltrexone is a monthly injection. The Suboxone is longer acting, and you have to remember that when you add more on, Suboxone has opioid-like side effects. So if you're going to be taking an opioid with that, you're going to increase your chances of possibly putting yourself into an overdose situation.
Well, I see the therapeutic duplication type of theme emerging here. Thank you for talking about that. Sometimes people that are on opioids will get some Narcan dispensed, especially somebody maybe that may be elderly or doesn't metabolize things as well with their liver or their kidneys. What's one of the dangers associated with that pharmacists need to counsel about? Angel.
I think that the first thing is that you want to have that in the home, okay, because it is a rescue medicine. Knowing, though, that if somebody does appear to be suffering from an overdose and you choose to use the naloxone to revive them, it is short acting, okay? They are going to wake up. They are probably going to, depending on, how sensitive they are, they could have immediate side effects. When they wake up, they could be startled, they could be angry, they could vomit, right? Just because you're kind of throwing them into a mini withdrawal, okay? So you have that. The other thing to remember, though, is depending on what kind of opioid they took, it could last longer than the Narcan. So whenever the home Narcan was handed out, it was always instructed when you administer it, the person really should still go to the hospital for evaluation because it's not going to just one and done be done. Depending on the duration of action of the opioid, they could relapse, okay? And you might not have a second dose of Narcan, okay? The other kind of a very rare and an oddball thing would be pulmonary edema. Narcan can lead to pulmonary edema. So it's not necessarily whenever you give large doses of Narcan. It could be that single dose of rescue naloxone that a few hours later, that person might start having shortness of breath. And I think that that's something that we need to be aware of as pharmacists when we're putting Narcan in the hands of people. If the person you have just given this to starts complaining that they're having a hard time breathing, that is something that needs to be treated in an emergency room right away.
I actually didn't know about that pulmonary hypertension piece. Thank you for talking about that. Another thing that I just thought of is that if somebody gets some Narcan and they don't teach the people around them how to use it, it's not going to do any good. Wendy, how about you? Anything that you want to add?
Yeah, that's a really good point. So we recently did have an opioid overdose fatality in one of our counties in Broward County, the home of Fort Lauderdale. And they had, they responded to the scene, and the decedent lived with a parent, an older parent, and the box of naloxone was visible from where the person had died. And the person had brought it home with them from a previous overdose, but no one had been instructed as to what it was or what it was for. And so that's a real weakness. We've seen a lot of misunderstanding too. So we work with South Florida Opioid Alliance, getting naloxone into the schools, which is an amazing addition, right, to their preparedness for these emergencies. But when we followed up with some of the schools, the principals had the Narcan locked up in the safe, and like they just didn't know what it was. They thought maybe it was addictive, maybe it was like methadone where it had its own risks. So a lot of misunderstanding still about naloxone and how it's used. Angel's earlier point about needing it longer and needing medical follow-up. One of the cases I reviewed was actually a suicide attempt in an older gentleman, 67. He had used his buprenorphine or Suboxone in a suicide attempt. He had a lot of other health conditions, but he spent multiple days on an IV Narcan drip to protect him over the time when his body was naturally breaking it down and excreting it. So it's not one and done. And I think people need to have an understanding of that.
Yes, that's a really good point for sure. Thank you both for talking about that. That case is not probably uncommon, where somebody who's maybe not metabolizing things very good takes too much of what they think is good for them, and then they end up in a bad way. And then, of course, we have I don't want to say illegal drugs, but the non-regulated drugs, let's just call them, the fentanyls and things like that, the non-regulated version, okay? Somebody takes them and it's very strong. And even if we can revive them, you really need to go to the ER right away. And I think as pharmacists, a lot of pharmacists do know that, but counseling, just making sure the words come out of your mouth at the pharmacy counter is going to save a life. So do it. Anybody else have anything to add about Narcan?
One other thing that just has to do with potential complications or after Narcan administration is in people who are heavy, regular users of opioids, someone who with long-standing use, their tolerance is going to be very high. And so in those cases, a single box or a double dose that's in that box, that 8 milligrams, is not probably going to be enough. And so that would be a time, obviously, that rescue needs to be involved. We always recommend that rescue is on their way, at least when somebody starts giving Narcan. And for a very small set of those folks, the very heavy long-term users, Narcan can also cause some cardiac effects for that population. So again, you want those people in care to look for what, Angel already mentioned, but also some of these very unusual cardiac side effects.
Thank you for saying that. I actually didn't know about the cardiac side effects either. I haven't been in this situation where I've been consulted for that part of the equation, to be perfectly honest. And I'm just laughing because it's like, I didn't see that coming. And a lot of pharmacists listening to this may also be in the same boat. And for me to admit I didn't know that should make you listening to this think, did I know that too? And if you didn't, use that information to help someone. Great discussion about Narcan. Is there anything else that we didn't talk about with things that could go wrong? Risks of keeping the medications to treat opioid use disorder in the house? Anything else either of you would like to add? Wendy.
Yeah, I have one additional case that popped up that was interesting. Angel mentioned children being curious and imitating, and being in the care of others. So one of the cases I reviewed involved a 3-year-old girl who was in care of her grandmother, and actually her grandmother was in treatment for substance use. So I think we need to not think about this as being a young person's issue. If someone has struggled with any type of drug dependency, they can and should seek treatment no matter their stage of life. And so in this case, this child ingested a small part of one of her grandmother's medications, and presented initially as sleepy, just sleepy, but the grandmother knew that that wasn't normal for her. And she did get that child in and get the child treated. And it was really good because by the time she got to the hospital, she was vomiting and some of the other symptoms were showing up, but she got the care she needed and it was a really good outcome.
Thank goodness. Yeah. Thank you for talking about, speaking of stigma. I mean, we think of it as a young person's problem. Really, a lot of people in the behavioral health hospital that I worked in were 25-year-old men, typically white men. And that was kind of who I saw. And they were not on any medications at all until they came to the clinic. So, yeah, stigma.
It's not unusual to look at our cases here and see folks, in their 60s that we are treating for overdoses. So it is definitely teens all the way through, on up, and just it's possible at any age. We don't want to kind of pigeonhole folks into this is only a problem for a certain age group.
Yes, these are excellent points. For the pharmacists at the pharmacy counter, in my outro for this episode, I will be sure to put all these counseling points in like a quick list so I can, review them. I love review. So it's great to learn it during the podcast episode, but then I will review it in the outro as well. At this time, I want to go to Wendy because I know she's got a few cases that she has not shared yet. And while we are pharmacists, and we can still learn from poison educators and their experiences. So, Wendy, what do you have?
So, the last two cases that I pulled for our podcast today were both sort of traditional medication mistake type stories. Every call has a story behind it. And these two, I thought, just exemplified how families are dealing with a lot, right? And people have a lot on their plate and can easily get confused. So one was an older man, 76-year-old man, who had a regular prescription for Suboxone, so as part of his recovery, and was distracted. And I think it was either the phone or the computer, he said. And instead of taking his doses 6 to 8 hours apart, he took them only 2 hours apart. And did have some symptoms and did need to be treated. So we would refer to that as acute on chronic exposure. So it did have a baseline, so it wasn't like someone completely new to it, but did have symptoms that were pretty potent just because of the timing. And then the other case was our very youngest case, was just a 2-month-old who was receiving medicine at home via NG tube. And somehow another family member's Suboxone was mistaken for the child's medicine and given it in addition. So it was just really remarkable, first of all, how young the child was and how very risky that is because of the small, the low weight and the vulnerable nature of a baby. But again, they got help in time. So these are medicines like any others. And so the storage, I think, is really, really important. Are all the family's medicines in one place? So that's not a great thing. And the other thing would be, take medicine when you're not distracted and have some sort of system in place. Whatever system works well for you. I know it's different for different people, but having some sort of system in place to avoid these spikes in what's a beneficial medicine most of the time suddenly at that dose turned into a problem.
And some of those practices can be very simple. Take a magic marker and color code labels whenever they come in the house. This color is for the baby. This color is for grandma. This color is for mom. This color is for dad. Just put a mark somehow on the bottle so that you're supposed to be reading the label each time, right? But just getting some sort of a color code there, even a sticker. To go ahead and put on each individual person's medicine, just kind of as I grabbed the wrong person's, right? So that's one idea. Another idea is when you realize, in the first case that Wendy just described, he admittedly was distracted, and that's fine. We all get distracted, but there are so many times that we'll get calls and the person will say, you know what? I can't remember whether I took my medicine. And my first question to them was always, so what did you do? And I'm hoping that they're saying, well, I called you first before I acted. so many times people will say, I couldn't remember whether or not I took my medicine, so I went ahead and took it again. And that's not great because sometimes it's better to skip a dose than to have a second dose on board, right? So the time to call the poison center, you asked me this question earlier, Kim, the time to call the poison center is at that moment where you're saying, I don't remember if I took my medicine or not. Call us. We can let you know. Is that one of the medicines it's better to have the second dose on board too soon? Or if it's better to skip that dose? And hopefully we can prevent some of that add-on effects, the acute on chronic that Wendy just mentioned.
Very smart advice, definitely. That would signal to me, if I were that patient, that I need to start printing out some sort of a calendar and handwriting down the name of the drug and when I took it. Because if it could happen once, it might happen again, especially with what was it, Wendy, a 76-year-old man? Memory problems begin as we get older, unfortunately. All right, these are great tips for pharmacists based on case studies. So unfortunately, there were some problems with that older gentleman and that teeny tiny baby, but we can all learn from those medication errors. And I was just thinking about that NG tube example and how you have to crush a medication and often you have to, hydrate it with some sort of juice or whatever the NG tube manufacturer says to push it through with, water, whatever. But I mean, that's a lot of trouble to go, crush that pill, add the water, and all that time you think you're doing the right thing. And then I'm sure that parent or guardian probably felt just awful. Wendy, anything to add about that?
Yeah, I mean, I think we've had, these cases I've shared are just a few of them, but we've had many cases of children inadvertently getting into an adult's, medication for their opioid use disorder, and they are doing the right thing. I think that that's so important. We don't want to discourage people from using these medications. Because they really do increase the likelihood of success and lasting abstinence from opioid disorder. So, yes, there are some risks associated with them. And yes, it is possible for these mix-ups to happen. But we really don't want people to be discouraged about using them when they hear these stories, right? We have a solution, right? The Poison Center is there. There's somebody who is friendly and knowledgeable to walk you through what to do. So we don't want people to be discouraged about using the products or too fearful to use them. But as professionals, we want to be aware of this problem and really actively reaching out to people who are using the products to raise awareness about that. The New York City Poison Control Center partnered with their health department to do a whole campaign specifically with a safety card and information to be dispensed with prescriptions for these drugs for families. That you're taking home this drug. We're really glad you're using it, and this is supportive of your health, but you do need to secure the products. So I thought that was great. It was really targeted message and not too scary, supporting families.
It's important to know that, Poison Center educators go out and educate like this all the time, but we can't be everywhere. And so just to be able to arm an army of pharmacists that can go ahead and help get our message out there, to remind folks along the way. And something else, and I think that I would encourage all of the pharmacists out there to contact your local poison center, because when we did, when in Maryland, whenever the take-home Narcan was coming out, many of the local jurisdictions included our magnet with the Narcan kit, right? And I'm sure that I'm speaking for all Poison Center educators in that if you as a pharmacist call and say, I would like some of your magnets or stickers or something to be able to give out whenever I'm sending home Suboxone or Narcan, or any of these potent opioids into a home where I know that there are children or anybody for that matter, we would be happy to go ahead and provide those resources to them.
That's a good reminder that the Poison Center can help with pharmacists educating their own patients. And what's that phone number, Angel?
1-800-222-1222.
Awesome. And if some pharmacist out there listening to this wants to get those magnets, they just call and say, I need to get some magnets from your poison educator for my patients, right? That's pretty much all they have to do, right?
that works. That's probably the quickest and easiest. Just they're going to say, Poison Center, can I help you? It's like, it's not an emergency. Can you connect me with the educator, because I would like some educational materials or magnets or what have you. And I'm sure that all of the centers can go ahead and get that transfer to happen.
Thank you. And this is the perfect month to mention that. This is Poison Prevention Month. It's March, right? I know we've got National Poison Prevention Week coming up as well. Wendy, did you want to talk about that since you're a board member for America's Poison Centers?
Yeah, this is a great time of year. I think having a calendar observance is helpful, because I know pharmacists are doing a lot of different things, but it's a nice week to acknowledge that this resource exists for patients and for families. And the theme of this year's observance is when the unexpected happens, Poison Help is here for you, because that's what we're offering through the 53 poison centers is immediate tailored help for any poisoning. And this is more than you get from a Google search. This is more than you get from a web search or an algorithm. You're talking to people. Real people like Angel, who have extensive experience treating poisoned patients. And they can tell you when it is an issue, and importantly, when it's not an issue, right? No one runs to rush to the ED. And I think, especially now with the concerns about, some people losing health insurance or costs of healthcare going up so much, that more people were worried will skip important treatments, but our services are free. And if we can provide that reassurance that you don't need to go, we can save people a lot of money and a lot of worry.
Thank you for talking about that. Wendy, I was just waiting for you to say they go to ChatGPT, but you didn't say it. But AI, a lot of people trust AI now instead of making appointments with a provider or asking somebody who has a license, whether it be a pharmacist or something else.
I did worry more about that before, but we are now hearing from our callers that ChatGPT told them to call. So I know I'm so excited about
yay.
that. Yeah. So rather than giving sort of some weird advice scraped off of 10 different web pages, from who knows where, and serving up something as relevant, that number now is at least showing up as one of the options. So that's really, really good news. But yeah, save the number in your phone and you'll never have to search for it.
So true. Yeah. 1-800-222-1222. And I will have that in the show notes today. Angel, anything to add about that, about National Poison Prevention Month or Poison Prevention Week?
I agree with Wendy. It's great to have an observance. It's great to use this week where there are some poison centers. We only have the bandwidth to do a week, but there are some that do stuff all month long. But, from my point of view, Poison Prevention Week is every week, right? You can always take steps to prevent poisoning. So we do a big push with schools during Poison Prevention Week. We're trying to get resources out there. But I always follow up saying, but you know what? If this isn't when it's in your curriculum, that's great. Call us when it ends up in your curriculum. We will send you materials any time of the year. And that goes to the pharmacists as well. Don't just think about poison centers in March, right? Think about us as an always resource. You can go ahead and ask for those magnets. And when you run out, ask for more. We are more than happy to go ahead and give you materials that you're going to put in the homes of your patients and hopefully, potentially save a life, potentially save an emergency room visit, using the resources in the right way.
Thank you for that, Angel. Wendy, I think I forgot to ask you when the actual Poison Prevention Week is. Would you like to talk about that?
Every year, National Poison Prevention Week is the third complete week in March. So in 2026, that's March 15th to the 21st. So there will be observances around the country. Your local poison center may have activities or materials that they're creating. And then there's also a toolkit for partners with a lot of great social media resources sort of pre-made for you with some messages and that type of thing. And they're geared to different audiences. So it's not only for small children or families. There are some that talk about teen exposures, just about medicine mistakes or chemical mistakes. So there should be something in that package that would be useful for you.
Thank you for talking about that. That reminds me, I need to get some Instagram posts out there and post something on LinkedIn. I usually try to help spread the message because I think poison prevention education is wonderful stuff. It can save a life. Just talk to one person. You might be able to just have that ripple effect where what you say to them ends up saving a life down the line.
And there is good evidence still, even though there is a lot of skepticism now, of experts or, even doctors now. Unfortunately, there's like a lot of misinformation and, strange stuff circulating online. But there is evidence that people do trust their pharmacists and appreciate that advice. And, poison centers are able to provide help in that moment. And people are so grateful. And I mean, our satisfaction for our calls, it's always up over 99%. It's a really beloved service. So we're proud to be there for our callers.
And Kim, I think this would be a really great time to remind your listeners, whenever you call the Poison Center, you're speaking to a pharmacist or a nurse, or in some cases, a physician, right? And so these aren't volunteers that are just kind of with no background. These are specially trained pharmacists, nurses, healthcare providers that are answering your questions and talking to you. And remember that there are emergency room doctors and ICU doctors that are calling us asking to help manage their patients. So absolutely, if doctors and nurses and first responders are using our service, we clearly have that expertise that the general public should feel comfortable and confident in calling us, and that we're going to give them the appropriate answer and right away.
That's a good reminder. You are the poison experts, America's poison centers. Are there any cases that we haven't covered yet? Maybe a case of calling the emergency department or anything like that? Anything that you didn't have a chance to share yet, Wendy?
We had one case a number of years ago when I was fairly new at the Poison Center, and I just happened to be walking past the specialist who took the call at the time, and it was his tone of voice that got my attention. And I just heard him say very, very calmly, I want you to lean forward and I want you to put your cheek up by the baby's mouth. Is the baby breathing? And it was Suboxone. And the child was breathing and they were able to call rescue and they got help in time. But the parents' medicine had been left on a bedside table, which is, as you can think of, it's right at eye level to a child, right? And the bottle rattles, right? And so there are all these things that just went together in that moment, that here was a parent doing the right thing for their own health that had inadvertently put the child at risk. But again, the parent did the right thing again by calling. And so I checked back in with him later. I was like, Michael, what happened to the baby? Like, I was a parent at that time of young children myself. So it was really frightening. And he said, 15 minutes, he said, they were on scene and had the baby was breathing, and with naloxone, right? Because they carry it on the ambulance. For him, it was a tremendous win, but for me, it was terrifying. And I really sympathized with that parent, who was trying to do the right thing, and then here's their child getting into this and putting their life at risk, and just what a terrible feeling that was. So, we're really there for everyone. No shame, no blame. We're all faced with these challenges, but that was a powerful moment. And I was so glad we were there to help.
And I will speak for poison specialists across the country. This is a group of people who are very passionate, who are very good at what they do, but most importantly, they are so calming and reassuring. Almost all of our caller satisfaction surveys say, I can't believe how they calmed me down. They made me feel so comfortable and confident that everything was going to be okay. And they're truly special people. So, by all means, get as many people to call them, and you won't be mistaken by doing that.
There's something about the power of the voice. There is power in having a voice and using it correctly. And I appreciate those messages. And that's twice now that Wendy's said, you have to do the right thing for yourself. If you are in recovery, and you need that medication, take that medication. Accidents do happen. So I like how you were reassuring that that parent was doing the right thing for themselves and that it was an accident. And thank God the children survived. And then hopefully nothing else went wrong, and hopefully they continued in their recovery and took their medication as scheduled. Things happen. And when problems happen, that's why there are resources like America's Poison Centers or 911. There are people there that can help, and they are educated and they are ready. As we start to get towards the end of this interview, I want to talk about one of the things that we had discussed during our planning meeting, and that was that sometimes people have these opportunities to add their opioid use disorder history to their health conditions. So as pharmacists, of course, in the pharmacy, that would be incredibly helpful in case somebody relapses and they no longer want to take their recovery medications. Having that opioid use disorder as a health condition can be really helpful. Angel, what would you like to say about that from the point of view as a poison center educator?
It's really important to have a complete medical history and medicine history always. And we want to encourage patients to not withhold information from any and all providers. So as a pharmacist, you want to know everything that they're taking, right? You want to know what over-the-counter medicines they're taking regularly. You want to know, right now across the country, cannabis being so readily available. You want to know if they are using cannabis because all of these things could interact or could be additive effects. So it's really important to have an accurate and updated medical and medicine history at the pharmacy, but also at all providers' visits. You want to go ahead and encourage your patients to share all medicines with all providers, not just silo it and just talk to each doctor about the medicines that they're prescribing. You need a complete history.
Disclosure is important. That's the message. Disclosure is important. Wendy, anything to add?
Yeah, when we teach our rotators, when they come through, I do a poison prevention outreach training with them so that they go on to become advocates for the Poison Center. And as we end up, I talk about adult safety, and that really comes up. So when we ask about, have you had any substance use history or whatever, sometimes the questions that are in the medical record are very dry or very do you use drugs or have you used drugs or whatever? And it's just very easy to say no. And so I have encouraged them to add on, are you using substances or are you in recovery? Because that's, first of all, a positive thing. That's a thing that people want to talk about and they're proud of it and they want to protect it. And it's also an opening for somebody to say, well, I was in recovery, but I relapsed and I've had a hard time. So it's just because substance use disorder, that's still a negative thing to bring up. It's hard for people to talk about it, even when they're being asked, when it's easier to say no. So that's kind of a different way. And you mentioned earlier, recovery is an iterative process. We expect there to be relapses, and that is part of the process. I've heard estimates of 5 different relapses on average as part of that process. So people shouldn't feel that they're failing, but they also shouldn't be put at risk by providers who haven't asked those questions and inadvertently prescribe something that endangers that really life-saving, process of recovery.
It is a tough subject. We opened up talking about stigma and how there's some stigma associated with being in recovery or having a relapse. And I have seen it where somebody will have a relapse and they'll go to a different pharmacy, right? And we have this thing in Ohio called the Ohio Automated RX Reporting System, otherwise known as ORS. And so it's a drug monitoring program, Ohio's prescription drug monitoring program. And I would see people who would relapse and they were previously on Suboxone. And then all of a sudden they're going to 6 different dentists for 6 tablets of Tylenol number 3. And that is how they have chosen to, fall off the wagon and start using again. And it's such a low dose of codeine. And I just think, oh my gosh, they just must really be struggling. And I probably shouldn't say that, but the stigma associated with the relapse is, I'm sure, very difficult for them to deal with. But as pharmacists, this is a very awkward conversation. But we have the opportunity to say, listen, I noticed you're on Suboxone. You're in recovery. And we can approach that. I know that is not at all part of this conversation from the point of view as a poison center educator. But I just wanted to say for pharmacists, when you catch something like that, you have the opportunity to help somebody get back into recovery. And I know it's an awkward conversation, but if you see something, say something, because you could really help someone protect their recovery, like Wendy was talking about. Wendy, did you want to say something?
Yeah. And I hear from the public when I'm out doing this work that people will come to me and say, I have to fend off my dentists and my doctors that, they've had to really say, you can't prescribe me that they haven't really considered the medical history, or they haven't reviewed the medical history. And what's easy or reflexive is that opioid, and you can't put them at risk like that. So they've felt frustrated. They expressed that to me, that they felt that they were inadvertently being endangered by their providers. So yes, it's awkward to talk about, but there will be people who really appreciate the acknowledgement of the hard work of recovery.
And it will only be awkward the first few times that you do it. As soon as you make it part of your normal, everyday routine interaction with your patients, it will become as natural as counseling on side effects.
That's good encouragement. I think that we as pharmacists have the opportunity to protect individuals' recoveries. And also, there was another thing that we had talked about, other than putting it in the health app on your phone, do not give opioids, or in recovery from opioid addiction, some messaging like that. You can also get some sort of a medic alert bracelet or a necklace or something like that. Any other ideas on how to communicate that? Maybe if somebody becomes unconscious for some reason.
Kim, I wasn't sure if they had medic alert bracelets for substance use disorder, and in fact, they do. So again, if you could, as a pharmacist, that is something that you could, encourage. If somebody is struggling, like Wendy just described, with the other physicians trying to prescribe, or if you're in fear of, maybe relapsing, and having that bracelet on. I think that's a great idea. They are available.
Wendy, anything to add?
There's also other substances that are out there that are sold and quite available that have similar effects to opioids that can also put people's recovery at risk. And so we're there, the Poison Control Center is there if you have questions, if someone, offers you something, at a gas station, or you see a product and it's advertised or whatever, because there are now quite a few substances that are freely available out in different states that may trigger similar responses as opioids. And often they're marketed as opioid substitutes. And the safety of those products all over the place. So that's another thing we want people to call if they're considering a natural product or a supplement that has been promised to help with opioid withdrawal or, recovery, to be maybe skeptical of that and to call and try to find out a little bit more before putting yourself, at potential risk with these products.
That's good advice. Yes, that's another way to protect somebody's recovery. I think we've got just one topic left here, and that's terminology. There are some people out there listening to this who may think, my patients don't respond well to the term opioid use disorder. They call themselves an addict or some other word. So when it comes to terminology, what are we supposed to do? It can be so confusing. Among clinicians, we use these formal, stuffy terms, and then our patients use other terms. So what do we do, Wendy?
Like any subculture, different ones have different lingos. So when I'm in my public health world and I'm at the Department of Public Health Sciences here at University of Miami, you do hear opioid use disorder, you hear substance use disorder, medications for opioid use disorder, right? And all those acronyms. And those are appropriate for academic literature, for research studies, for grant applications, right? So for folks who are working on those areas, we would expect the use of those academic terms. But when you're working with people, particularly people who use drugs, that is a term that I've heard. So people who use drugs. So it is shortened to PWUD. So if you see that, it's very straightforward.
I have not heard that one. Thank you.
Yep, that is now one that's more commonly used. So people who use drugs. That's how people talk about it themselves. we do certainly want to avoid words that are inherently stigmatizing, like junkies and stuff like that. That is always inappropriate. Addicts, I've heard people on both sides of that discussion. Some people will use that term for themselves and people they know who have, had developed these disorders and these dependencies over time. But I would say listen to how people describe themselves or ask, right? My daughter, my young daughters always help me with this. I'm like, should I do this or that? And she's like, just, do I refer to this or that? And she says, just ask. So, how would you be more comfortable with me referring to this condition? That's never a bad idea.
I completely agree. You have to meet people where they are. Their terminology is the terminology that pharmacists should use when speaking with them.
I agree very much about the meeting people where they're at idea, because I think we just want them to listen to us. And if we use the wrong terminology, I think they can sense, their radar goes off. This person cannot be trusted. They're not the right messenger for me because they don't use my words. Anybody else want to add to that?
Or they're not listening. They're not listening. So another thing we talk about with our training with our rotators is reflective listening. And that can be very helpful. So if somebody says, I went back and I took this drug, and they use a term that you wouldn't use, but if you can mirror that back to them. So you're saying you went and you took this drug and, and now you're feeling bad or whatever. The fact that you've used their language and you replay it back to them is very calming because they don't have to say it again. Like you actually heard them. Now, would you rephrase that in a different way if you were talking to a colleague? Maybe, but you're talking to the patient, right? So using their terminology and repeating it back to them is a very calming practice, even though it does feel artificial. But you'll find that it calms people down and it short circuits some of the repeating and the escalating. Because if people, we're hearing on the phones, right? Angel, people will say, you don't understand. My child just ate the lip balm. Like you're not listening to me because the person sounds so calm, So it helps when you repeat it back to them because then they can relax because they heard their own words coming out of your mouth. So that's sort of a good rule of thumb for terminology is use their language as much as possible.
I love that you just said that because that's the opposite of what we do with the teach back method with medications. Like you give somebody a Z-Pak, right? You take 2 today and 1 every day for 4 days, total of 5 days. And if they've never taken one before, they look at you like you have 2 heads because they say, what, 2 of them? Really? Is that okay? Am I going to hurt myself? You are not going to hurt yourself. That is just the normal directions. And then you can ask them just to make sure that you as a pharmacist feel confident. Could you please tell me what you're going to do with this medication? And they'll say, I'm going to take 2 today, and then I'm going to take 2 tomorrow morning and, or something. And maybe that hasn't been exactly 24 hours. So then the pharmacist can kind of counter offer and say, well, you might want to put 24 hours between those. That teach back method really helps us as pharmacists to make sure that the patient knows what they're doing. But then when the patient or the caller, in your case, tells a story, and then you, as the poison center response, says back to them what you just heard, then they feel confident that you're on the same page. That is so interesting that you talked about that today. Thank you for sharing that. I think that's all I wanted to cover with terminology. Thank you. That was very productive, I think. I learned a lot there. Is there anything else either of you would like to talk about for the Poison Prevention Month or this topic with opioid use disorder, good news, bad news, risks, benefits, etc.? The floor is yours. Let's go to Angel first.
Thanks, Kim. At this point, I don't think I have anything to add. I appreciate the opportunity to come back again this year and spend some time with you and Wendy, and look forward to maybe next year with a different topic.
Yes, ma'am. Thank you so much for being here. And Wendy, any last comments?
Well, thanks so much for highlighting this topic. It's wonderful to be able to say we're moving in the right direction, with these overdose deaths coming down, and the Suboxone and the other medications are just one part of the puzzle. We have to keep doing all the things we're doing in terms of prevention, safer prescribing, et cetera. But it's exciting to be able to say things are going well. So very happy to be here and to share this message with your audience.
Thank you both for coming back to the Pharmacist Voice podcast, and I hope to see you again next year.
Thank you.
Thanks again to Angel and Wendy for returning to the podcast. This is at least the fifth time we've worked together, and we work together really well. They brought a lot of great points to our discussion, and remember, their point of view is from the poison prevention world. They're poison prevention educators. Now, I said that I would review the takeaway messages for pharmacists. Also, these are great for pharmacy techs, pharmacy students, pharmacy owners, etc. Let's get into that next before I wrap this episode up. And just to set the stage here, when I looked at the transcript, I found more than 20 takeaway messages. And I'll be reading from a list. Sorry if it sounds like I'm reading, but here we go. Number 1, overdose deaths declined between 2023 and 2024. Number 2, more than 23 million Americans are in recovery or have recovered from substance use disorders. Number 3, the stigma that's associated with recovery needs to decline as the number of people in recovery increases. Number 4, I love this one. Recovery is possible and it's probable. Number 5, poison prevention educators talk to students and communities about substance use disorder prevention. Number 6, opioid use disorder has many possible entry points. We talked about painkillers from surgery or dental work, experimentation, accidental use, and there may have been some other ones listed, but those are the ones I remember. Number 7, pharmacists have the opportunity to counsel on proper use and storage of medications for opioid use disorder. Counsel on use and storage. Great point. Number 8, take oral doses in private, and that's so that vulnerable individuals cannot see. If you can imagine, children or developmentally disabled adults or intellectually disabled adults may want to imitate the behavior that they see. So take oral doses in private. Number 9, avoid medication errors. Remove distractions while taking or giving medications, and read the label every time. If needed, keep a personal medication administration record to remember if a dose has been taken yet. Number 10, if a medication error happens, like with the baby and the NG tube, get help. Call the poison helpline or 911. Go to the emergency room, whatever you're supposed to do. But afterwards, forgive yourself and then continue on your road to recovery. Number 11, Narcan is important for anyone in recovery to have, but a person experiencing an overdose will be unable to give themselves the Narcan, right? So make sure your patients who get Narcan educate the people around themselves about what Narcan is, when to use it, and how to give it. Number 12, as a general rule, counsel on calling 911 after giving a dose of Narcan. Narcan can wear off. Number 13, counsel on risks of keeping medications for opioid use disorder in the home. Risks include accidental use or intentional use by a curious opioid-naive child, confusion with other medications, and taking a second dose by accident. Number 14, call the poison helpline right away with exposure concerns. Skip right to 911 if the person is not breathing, not conscious, or having a seizure. Number 15, Poison Center staff are experts in poison information. They help healthcare professionals with questions as well as the general public. So if you call, you're in good hands. Number 16, grown-ups of all ages may be in recovery. It is not just a health condition for young people. Number 17, you can get Poison Helpline magnets for your pharmacy and share them with your patients and colleagues. If you need some magnets, call 1-800-222-1222 and just ask. Number 18, the month of March is Poison Prevention Month in the United States. National Poison Prevention Week is March 15th through 21st, 2026, and the theme this year is When the Unexpected Happens, Poison Help is here for you. If you would like some images to share on social media, there is a partner toolkit with images and talking points online. I will have a link to that in the show notes on thepharmacistvoice.com. Number 19, a complete health history is important. Ask about recovery. Include in recovery from opioid addiction as a health condition at your pharmacy. Providers can do this too, and anyone who has access to an electronic medical record could include this information as well. Number 20 is advise patients to inscribe do not give opioids on medic alert jewelry. We're talking about bracelets or necklaces. If you do not know what medic alert jewelry is, I'll tell you it was very popular in the 90s and the 2000s. Don't know how popular it is today, but people wear it to alert first responders as to their health conditions. So if you put on the back of one of those bracelets or the necklace, do not give opioids, the first responders will get that message loud and clear. And on a similar note, advise patients to include do not give opioids in their health app on their smartphone, just in case of an emergency. So, just in case a first responder responds to an accident and the patient is unconscious and the first responder reaches for that smartphone, looks up the health app and sees, name, date of birth, blood type, whatever's in there, they can also see do not give opioids. All right, we're in the final stretch. There's 3 left. These are all great points, so I'm glad you hung in there with me. Number 21 is for pharmacists. This is a tough one. If you see something, say something. If you see something on your state's prescription drug monitoring program, like in Ohio, we have this thing called ORS. If you see something that suggests your patient is in recovery, but they are trying to fill prescriptions for opioids, protect their recovery. Maybe a well-meaning dentist, doctor, or surgeon wrote a prescription and didn't know the whole story. Or maybe your patient wants to relapse. If you see something, say something, even if it feels awkward. You have my permission to. You could prevent a relapse and maybe an overdose. As we know as pharmacists, opioid tolerance is lower when someone is in recovery. They haven't had those opioids for a while. It's going to take a smaller dose to get them into an overdose. Number 22, be skeptical of natural products and supplements that promise to help with opioid withdrawal. And finally, number 23, terminology matters. Know your audience and reflect their preferred language back to them. Avoid terms that are stigmatizing, like junkie. When in doubt, just ask the person you're talking to how they prefer to call themselves. And that's it for my review. Thank you so much for hanging in there. There were a lot of great takeaway messages there. Now let's wrap this episode up. Thank you for listening to episode 368 of the Pharmacist's Voice podcast. The show notes are on thepharmacistvoice.com. In the show notes, you will find lots and lots of links today. I've got links to other episodes that Angel and Wendy and I have recorded on this podcast regarding poison prevention. There is the poison helpline number in the show notes. There's a link to the partner toolkit for the National Poison Prevention Week coming up the 15th through the 21st of March, and so much more. Everything you need is on thepharmacistvoice.com. Lots of links today. As we wrap this episode up, I would like to ask you to do me a favor. If you know someone who would benefit from hearing this episode, please share it with them. If you're a pharmacist, please share this episode with your students and techs. There's a lot of great information from the point of view of a poison prevention educator. And if you like this podcast, come on back. We've got a lot more coming up here in 2026. Subscribe to or follow the Pharmacist's Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Thanks so much for listening today. I'll talk to you next month.